Good afternoon, Sharon Sheffield. Let's begin the warm-up session. What are the current trends in nursing?
Some of the current trends in nursing include telehealth and technology in healthcare, the use of telecommunication and information technology to provide healthcare services. In the field of education, graduate education and advanced practice are on the rise. There is a push toward encouraging nurses to pursue higher education and advanced credentials, such as master's degrees and advanced practice registered nurse roles. There's also a shift from hospital-based care to community-based care, as more patients prefer to receive care at home or in outpatient settings. Alongside, nurses are coming up with innovation and entrepreneurship. That is, nurses are opening their own healthcare businesses, developing new products or services, or working for non-traditional employers.
How to communicate with patients effectively.
To communicate with a patient effectively, you should greet the patient with a smile and their name. This helps to create a positive and respectful first impression and shows that you care about the patient as a person. Take your time, even if you're in a rush. This helps to convey that you are interested and attentive to the patient and that you value their time and input. Try to avoid distractions, interruptions, or multitasking while communicating with the patient. Importantly, explain things as simply as you can. This helps to ensure that the patient understands what you are saying and avoids confusion or misunderstanding. Use plain language, avoid medical jargon or acronyms, and give examples or analogies when possible. Finally, ask your patients if they understand everything to check for comprehension and clarify any doubts or questions.
What is the dignity of being a nurse?
Being a nurse is a noble and rewarding profession that involves caring for people's health and well-being. One of the dignities of being a nurse is respecting human dignity. Nurses respect the inherent dignity, worth, and uniqueness of every person they encounter, regardless of their health condition, culture, religion, or background. Nurses treat their patients with kindness, compassion, and empathy and uphold their rights to privacy, autonomy, and quality care. Having a sense of purpose. Nurses have a meaningful and fulfilling career that makes a positive difference in people's lives. These are some of the dignities of being a nurse that make it a rewarding profession.
How would you deliver bad news to a patient or their family members?
It is a tough but inevitable part of the job, and I believe I have learned to navigate it effectively. I understand how hard it is to watch a loved one feel uncomfortable, so I always try to demonstrate empathy when speaking to patients' family members. I calmly explain the patient's condition and the next steps we need to take, giving them time to process that information and ask as many questions as they need. Even though the news must be upsetting, I knew I needed to be honest about the situation to manage their expectations appropriately. I would never want to give families false hope about the outcome. However, I also emphasized our medical team's commitment to providing him with the best care and treatment options available.
Describe your ability to handle high-pressure situations.
I've always done well with deadlines and thrive in a fast-paced work environment. During my time at the urgent care clinic, I have helped numerous patients with illnesses, injuries, and health crises. One particular day, a mother brought in her young child, who had been quite ill. During the intake process, the child became unresponsive, and I had to think quickly and act calmly. I immediately began checking the child's vital signs, sent the other front desk worker to get the doctor, and began cardiopulmonary resuscitation, which I continued until a physician took over. The child was ultimately revived, and my ability to act quickly using the training I had acquired was an integral part of saving that child's life.
Your preparation time is over. Please start your OET speaking roleplay.
Hello, good evening. I'm Nurse Sharon Sheffield. Please have a seat. May I know your name, please?
Good evening. My name is Mihiraa.
Mihiraa, may I know the reason for your visit, please?
Nurse, I'm actually going on a holiday overseas, and I'm really looking forward to it. But I have to admit, I'm also a bit nervous because I get terrible motion sickness.
It's completely understandable to feel both excited and a little nervous. My role today is to help you prepare so you can focus on enjoying your holiday. To start, could you tell me a bit more about your trip? I'm interested to know where you're going and what your travel plans involve.
We're going to Switzerland for 2 weeks. The journey there is a long-haul flight from here, and then once we're there, we've booked a couple of scenic bus tours through the mountains.
Switzerland sounds wonderful. Those bus tours will be beautiful. Now, to help me understand how best to advise you, could you tell me about your past experiences with motion sickness? For instance, what usually happens, and does it differ between flying and being in a car or bus?
Oh, it's been a problem for as long as I can remember. On buses, I start to feel very nauseous and sometimes even dizzy. Flying is a bit better, but I still feel unwell, especially during takeoff and landing or if there's any turbulence. I usually can't read or look at my phone for long without feeling worse.
Thank you for sharing that. It gives me a very clear picture of what you're dealing with. Mihiraa, we can discuss some practical strategies you can use that don't involve any medication at all. These focus on controlling your environment and your behavior to minimize the conflicting signals your brain receives. First, where you choose to sit is incredibly important. On the plane, I strongly recommend requesting a seat over the wings, as this is the aircraft's center of gravity and experiences the least amount of movement. On the bus, aim for a seat near the front where you can clearly see the road ahead through the windshield. This allows you to look at the distant horizon, which helps your inner ear and your eyes agree on the motion that's happening. Also, make good use of fresh air. Direct the vent above you on the plane towards your face, and if possible, open a window slightly on the bus. In terms of what you do, it's best to avoid activities that fix your gaze on something close and stationary, like reading a book or looking at your phone screen, as this can worsen the feeling of disorientation. Keeping your gaze forward and your head still is often the most effective technique. How do you feel these kind of strategies might work for you on your trip?
That makes sense. I always try to look out the front window, but I didn't know about the seat over the wing on the plane. I'll definitely try that.
Good, I'm glad that makes sense. Mihiraa, what you eat and drink on your travel days is also very important. We can now talk about how your diet on travel days can play a big role in managing motion sickness. What you eat and drink is something you have direct control over. My main advice is to focus on being kind to your stomach. This means choosing light, bland meals before and during your journey. These are gentle and much less likely to upset your stomach if you feel nauseous. It's also crucial to stay well hydrated by sipping plenty of water throughout the day. However, it's just as important to know what to avoid. I strongly recommend steering clear of alcohol, caffeine, and heavy, greasy, or spicy foods, as these are common triggers. Even strong smells like certain perfumes or heavy food aromas on the plane can provoke nausea, so it's good to be mindful of your environment.
I usually avoid spicy food, but I hadn't thought about strong smells. I'll be sure to pack some very plain snacks for the journey. Do you have any other tips?
Now, let's move on to discussing medication options, which can be a very effective part of your plan. Mihiraa, there are a few types available over the counter. The most common are antihistamine tablets. Another excellent option is a medicated patch, which you place behind your ear, and it steadily releases medicine for up to 3 days. The key to success with these is timing. You must take the first dose before your journey begins, typically about an hour before your flight or bus tour, to prevent the nausea from starting. It's much harder to stop the sickness once it has begun. It is also crucial to follow the dosage instructions on the packet carefully and not to take more than recommended. A very common side effect of many of these medicines, especially the older antihistamines, is drowsiness. This means you should avoid driving or operating heavy machinery. However, for a long flight, This sedating effect can sometimes be beneficial. Do you have any other questions or concerns?
No, I think that covers everything. You've been very helpful and have given me a lot of useful information to think about.
To make sure you have all this information at your fingertips, I'd like to give you this comprehensive travel health brochure. It reiterates everything we've discussed today about motion sickness, from seating tips to medication guides, all in one place for easy reference. More importantly, please take a moment to look at the back page, where you will find a list of essential emergency contact numbers. This includes the local emergency services for Switzerland, as well as the contact details for our nearest embassy or consulate. I strongly advise you to save these in your phone as well. It's always best to be prepared so you can travel with greater peace of mind.
That is so kind of you.
I'm glad to hear that. Mihiraa, let me just quickly summarize everything we've discussed today so it's clear. We talked about your trip to Switzerland and your history with motion sickness. We covered non-medication strategies like choosing a seat over the wing on the plane, sitting at the front of the bus, and looking at the horizon. We discussed eating light meals and avoiding alcohol and strong smells. Finally, we went over medication options, emphasizing taking them before travel and being aware of side effects like drowsiness.
Thank you so much, Nurse Sharon. I feel much more prepared now.
You're very welcome, Mihiraa. I hope you have an absolutely fantastic and comfortable holiday. Safe travels.